Hello and welcome to my channel. My name is Peter Abraham. I'm a second career registered nurse focused in the areas of advanced illnesses, specifically those that would qualify for either palliative care or hospice care. Those are two separate types of services. I'm also a certified end-of-life doula through the International Life Movement, an avid writer having published well over 500 articles, an avid book author, self-publisher, having published 21 books for hospice nurses. Many of them are used nationwide for training and orientation and ongoing development. 24 books for hospice caregivers, including my latest one, The Hospice Journey. 5 books for my holistic nurses, the latest of which is Validation in Action. 6 books for my fellow end-of-life doulas. If you're new to this channel, welcome. Thank you so much for taking the time to visit. In this channel, we talk about issues related to death and dying in this industry overall. If these are topics of interest to you, please consider subscribing, hitting the bell notification below. I try to publish videos every Monday, Wednesday, and Friday, which, by the way, is the same time I have articles coming out at compassioncrossing.info that deal with chronic illness, terminal illness, death, and dying. On the YouTube channel, more often than not, it's the business spectrum, like videos to help my hospice nurses, video to help my fellow end-of-life doulas, and so on. Occasionally, I'll have videos for patients, families, and caregivers, but usually I hit those from an article perspective on compassioncrossing.info. And if you like what you're seeing, please do hit the like button. It does help get my message out to more people. So the topic for today's video is I really appreciate Death Doula Kacie. And she did an excellent, very concise, very to the point, I don't know if I want to say article, but it hit home and in so many well done areas. And so I just want to go over this with you. I know this is something that I'll put in a link in the description below. Yeah, I could read it myself, but I also want to go over one of the comments that came out from this is anytime that we as death doulas, end-of-life doulas come into the picture, either the hospice agency, you're not needed, or they're offended, or somebody saying, why on earth are you needed? We have hospice. So I'd like to address that issue and hopefully give you some insight, some brainstorming. To me, it takes a village. We work better as we brainstorm. Before I go into today's topic, I want to ask you, what are you grateful for? What are you grateful for? I believe we need to build resilience. We get, I don't know always the best word on my INFJ, so sometimes I struggle. There has to be a better word for this. But we all struggle with things that just didn't go our way, or we have a loss, or something's taken from us, or somebody else, or whatever. But we have to deal with that. And in my experience, one of the ways to deal better with it is to build resilience. There are 3 pillars. I ask about one on this channel. If you're interested, what are the other 2? Tell me more, comment below. But having a grateful heart builds resilience. What are you grateful for? So what I'm grateful for is I had a very productive meeting with the Madison County Department of Health. I'm filming this in advance of publication. Today is Monday, October 20th. If you watched the other video that came out Monday, November 3rd, yes, I did 2 videos October 20th, but I met with the Madison County Department of Health with Ava Wright, the Director of Nursing, and Amanda Smith, one of the lead educators, and a very productive meeting. Through that meeting, I made a connection with the Executive Director of Berea Village, and so I scheduled being a volunteer for Berea Village, and I'm working with the Executive Director to try to get a meeting with her and the President on how I, as Compassion Crossing, can come in and do educational events. So that part I would offer as well for free, but with the hopes of raising awareness. It's not everything for free or volunteering for free, but raising awareness for the long journey of the services that I could provide. And I offer my services on a sliding scale. Yeah, tongue-tied. Wow. sliding scale fee, because if they could pay full price, wonderful, but I don't want people getting left behind if they can't. And then I'm also grateful for Sandy Adams. At the time that you've seen this, it would have already gone over. I don't know how it's going to be. It's tomorrow morning, 7:30 at the Just Love Coffee in Berea. I'm having the opportunity to speak about what is a life transition coach. That's what I call myself. I am a RN concierge service plus end of life doula service. I look at it as life transition. What is a transition? A new healthcare diagnosis or grief event. And so I'm getting to do a presentation to the number of people that come. And sometimes it's 15, sometimes it's 25, 30 people that come, as to what is it, what do I do, what do I offer to the community, and to integrate that into Breast Cancer Awareness Month. And I'm going to be bringing it into any type of cancer, any type of diagnosis, but I will be hitting on breast cancer issues. Now, getting to the topic of today's video, let me just go, and I'll be putting in a link so you can have Casey's LinkedIn. So if you want to connect with her, she's a kind and thoughtful individual. Just as a side note, I want to be, before I go too much further, those on the top collaborate. Those on the top collaborate. Those on the bottom compete. The top collaborate, the bottom compete. The bottom push people away. The bottom say, this is my space. But those that are on the top, we collaborate. And when I share this, I want to be transparent, as I have been, as I try to in all my videos. I've been building up. I'm brand new with doing this. I even know how to phrase. I've been doing it remotely for close to 2 years, if that. But it's still brand new. And it is brand new in Madison County, Kentucky. Compassion Crossing LLC didn't exist until May of this year, 2025. So I'm not on the top from that perspective. Casey's been doing this longer than I. And Adams, the founder of the International Life Movement's been doing it longer, I think, than both of us. But we build by helping everyone bloom. We build by lifting everyone else up, because along the way, we're going to get lifted up too. This isn't about karma. I don't believe in karma. I believe in Christ Jesus. I'm not trying to preach at you or to you. But Casey has a different perspective on things. And I like that, because if we all were in the same echo chamber, we don't learn anything new. We don't grow. We don't bloom. So her target market tends to be a lot younger people, and she does an amazing job at this. She does an amazing job at connecting to young adults. She's not only a death doula, she's also a registered nurse. I don't know if I believe she still has her RN license, and she has this here. She does have her own school. Yes, I still endorse the International Life Movement, but on my Compassion Crossing.info, in the resource section under end of life doula resources, I list several schools. Casey's one of them. I list University of Vermont. Again, it's about collaboration. And I know if you go there, I think I have 4 schools listed, and I also list the National End of Life Doula Alliance, which is not a school. And I realize there's more, but I have not had the opportunity to do any type of due diligence. And I've not taken her course, just to be clear, when we talk due diligence. I just know enough people who have taken her course that I feel comfortable saying, hey, she's somebody that you could look at to see if you mesh, because part of it is meshing. This is an unregulated industry. Find out who will help you be uplifted, help you bloom, and help you grow. If it's the International Life Movement, go that direction. If it's University of Vermont, go that direction. If it's Laurel Nicholson, go that direction. If it's Death Doula Kacie, go that direction. So she is extremely active on LinkedIn. I don't follow her on Instagram, even though I'm on Instagram. But she has done a lot. She's made a lot of connections. And she is a good educator. So getting back to this post, You know, she talks about, let's starting off the week is because this is on Monday, again, the 20th. When I publish this on YouTube, I believe it's going to be Wednesday, the first Wednesday, first week of November. I think that would be the 5th. I don't have a calendar out in front of me. So she's breaking it down very concisely. You know, hospice is the medical support, managing symptoms. And yes, you can get into the social work does the psychosocial, the chaplain who is often not even involved. Like chaplains are, this blows my mind. They are the hidden gem in hospice, but most families don't even accept them. So most families are not receiving spiritual support, which is what end of life doulas can help with as well. So they're getting the medical support, managing the symptoms. Death doulas, the non-medical, and this is unbelievably key, the heart-centered approach. There's no limitations on this. And one of the major pluses, I mentioned this is an unregulated industry, it is private pay. There's no insurance regulations for us to follow. That's huge. That's huge. And we'll get into, when we get into like the question of hospices get offended, and you know, people are saying, well, we have hospice for this and hospice for that. But there's a gap, and I'm going to go over the gap in a moment. But educating the families. And I love how Kacie puts this. You know, hospice helps the body labor out of life, the labor of death, you know, birth labor versus death labor. A death doula is helping the soul, the whole psychosocial, spiritual, so that the families don't just receive care, they receive time, clarity, choice, and peace. And I am just so, I'm grateful for Death Doula Kacie. I do want to get into this comment here. This is a valid point. It's a balancing act, and I do want to get into that in a moment. But in order to get into that person's comments, I mentioned that on the 21st, I'm going to be presenting Life Transition Coach Breast Cancer Awareness at Just Love Coffee in Berea. And one of the things I'm going to be talking about is I have a case study of a local family I helped this past July, where I helped them go the route of hospice, and hospice got involved. But I also helped them through the hospice journey because I worked with the family. What is this behavior? So that's terminal restlessness. And the medications, me telling them, educating them, by what you're describing, the medications aren't working. Because in my case, I'm a registered nurse, but even if I wasn't, I could say the medications aren't working. You need to call the hospice. They're available 24/7, not on site 24/7, but they can come out and they can adjust. But in my case, I was able to give recommendations for what dose and frequency to ask for. Questions about oral care at end of life. What is this gurgle, this death rattle? And hospice was involved throughout all of this, and or oral care at end of life. Why wasn't hospice teaching that? And as I share this, this is not a down to hospice. This is a reality of the world that we live in. So Medicare requires a minimum of 30 minutes per any staff member that's billable in order to bill Medicare. So if Medicare is part, like if they're paying for hospice through Medicare, it has to be a 30-minute visit. Hospice nurse, 30-minute visit. A CNA or a home health attendant, a 30-minute visit. The social worker, 30-minute visit. Chaplain. You get the picture. The volunteer is not excluded because that's not a billable event. Minimum of a 30-minute visit if it's a covered service. So because of all the different shortages of staff, more of the management, more than not, nationwide, including Kentucky, are telling their nursing staff, you need to be in and out within 30 to no more than 45 minutes. 30 to 45 minutes. So I want you to think about something. 30 to 45 minutes. You walk in, you're asking, how was your loved one since I was here last? And you're getting that story. And I'm not saying everybody does that. That's what I do, because that's what I did as a hospice nurse. Not everybody does that, just to be very crystal. I would do my interviews. Then you have the physical assessment that, depending on what's going on, might be a head to toe. Might be we need to turn them over so I could check their sacral area, check their pressure points, look for skin injuries, progression of wounds, and so on. I might have to do wound care. I'm getting different vital signs. Depending on what the rules and policies are, this varies from agency to agency. I may have to count every narcotic in the home. I may have to do a comparison between, here's my ending count, but how much should be left based on the prescription, based on what was there before. All that takes time. Then there's documenting. That takes time. The hospice staff do not have the time in order to do the proper teaching. On top of that, part of the reason why the majority of my I mentioned at the start of this how many books I've written. Right now, it's, if you go to Amazon and you see my titles, it's 60 books. The majority of my sales come from the hospice books. And the reason that they're selling is hospice agencies are realizing that their staff needs more and more training. But even with those sales, which I'm very grateful for, and the training provided in those books, they haven't mastered it yet. And the Ohio family that I helped share with me, they were beyond grateful for their hospice nurse. But that hospice nurse shared with them that they're brand new to hospice. They've been a nurse for decades, but they're brand new to hospice. They came from long-term care. So they didn't even know what death and dying look like. How do you teach about something that you've never personally witnessed? You can't. So that's why we're needed. So coming down to the landing strip, how do you present yourself in front of a hospice agency? And so that you are aware, I've done this. The last Friday in September, I had the opportunity. I apologize. September, this is where in October. It was the last Friday in August. I apologize as I was off by month. Last Friday in August, I had the opportunity at Arcadian Cove in Richmond, Kentucky. That's a assisted living. There's a networking group of home health, hospice, caregiver, caregivers that would come in, and skilled nursing, and so on and so forth. It's a networking group. It varies on how many people come, 15 to 30, 12 to 30, varies from month to month. September was at Centerwell Primary in Lexington. I don't know what October will bring, but I had the opportunity to present what is a life transition coach? What do I do? Well, how did I end up having a pleasant conversation with the hospice provider? Because in all transparency, throughout my presentation, the person representing the hospice there, I could tell by the body language, the facial expression, they weren't happy that I was there at the beginning. They were not happy that I was there. When I brought up the fact, and it is a fact, that hospice agencies nationwide are not ordering the comfort kit to be delivered on the day of admission, and some not even the day after. Because these kits, that they're not euthanizing medications, but they contain the morphine, lorazepam, medication for the death girdle. More often than not, it's hyoscyamine, which is Levsin, versus atropine or atropine, tomato. But these kits range from $120 to $200 or more per kit. And they only last, depending on the pharmacy, they may have an expiration date of anywhere from 3 to 6 months. So in order to save money, a number of agencies nationwide, including Madison County, Kentucky, there's one documented case that I'm aware of, When I say document, I want to be very clear. We're not talking about a newspaper case. I'm talking about I talked to the nurse that was there when the medications weren't there and they were needed. And the same nurse, by the way, who got chastised because she went above and beyond to do the right ethical, moral, and legal thing for the family in getting the medications from the pharmacy and staying and making sure that they were given and that they were effective. But when I was giving my presentation and sharing that these are benefits of what we bring to the table, I was getting in. Well, our hospice agency always gets it there because they were the people in the audience was asking, does your agency get it there? And she said yes. And I knew that the answer was no. So that you're aware, I didn't challenge her. I got to pick your battles. And this is one case. It could have been a fluke. Don't know. I'll give them the grace. But what I did to turn things around is share how I support the hospice journey, how my goal and what I'm trying to do in the community. I want to have early adoption of palliative care. I desire to have early adoption of palliative care that's not hospice. I want to have early adoption of hospice. When I wrote my book, The Hospice Journey, I brought out several studies that discuss that if you start hospice as close to the 6-month mark, or a little longer if you get an agency, they'll give you grace. You have a nurse like me that fights for early admission. Like I take a patient, I think it's 9 months, but you know what? Let's get them on now. And I'll fight for them to be admitted. I'll fight for them to be admitted. Studies have shown that those who start hospices 6 months have the potential to live anywhere from 20 days to several months. For lung cancer patients, it's 2.7 months, like almost 3 months longer because they started hospice earlier. And when I shared that, and the person said, yeah, we're struggling in that area, I said, I want to help you. Now I'm getting smiles. Now, just in complete transparency, we're still on rocky road. I've not won them over yet. I'm working on that. I'm working on spreading. I can't say I'm a charming individual. I'm autistic, missing teeth. I'm not charismatic. I'm not somebody that could, lead somebody, Pied Piper and so on and so forth. But I'm persistent. I'm consistent, and I show up and I follow through. So I'm getting the message out there that I support you. I follow them on Facebook, not just them, but like Bluegrass Care Navigators, it's out of Lexington. Liking their Facebook when I comment in a positive manner. And I'm trying to work on building the relationship. I did send a letter to the CEO of the local Richmond agency. I've not heard back, but I shared, I have, and I do. This is one you toot your own horn. I have a proven track record of working with families who are on the edge of hospice and getting them to come on board. I have a proven track record. Granted, it's in Pennsylvania, but if it worked in Pennsylvania, to me, it would work in Kentucky, or at least give me the shot. I'll take the time. I'll put in the effort. So number one, get in front of in one way, shape, or form. And I've not been able to meet directly with them at their office. So by indirect means, by this networking group. And for example, I mentioned about tomorrow, if they have anyone present, because Just Love Coffee's been broadcasting who's coming. And I know from the previous events that I've been at, they've popped in and they've looked. That if they come and they hear me speak and I'm presenting, this is how we complement one another, they become less and less offended. How can you stay offended if I'm trying to give them business? If I'm trying to keep their business? You don't know how many times in Pennsylvania that have had families share that they were looking at switching to a different hospice provider, and then I came into the picture. And I'm not trying to say, ooh, Peter can solve everything. It's just the difference between me And what you bring, if you're an end-of-life doula, what you and I bring to the table, the difference is time. The difference is time. And I apologize, I don't have her thing memorized, but we don't have the limitations. We don't have the limitations. We're coming down to the landing zone, by the way. We don't have the limitations. A hospice nurse, you need to get in and out. Social worker, chaplain's not often, not even welcome in. And a lot of times I've had families, they only allow the hospice nurse in. We are not limited by time. I'm not saying that we have 24 hours a day, 7 days a week, but we can go in, and that's what we need to be educating the community. That's what I encourage you to do. Go to networking events, ask to speak. Today, when I reached out to the executive director of the Berea Home Village, I called and I sent an email. I did both. And in my phone call, I shared, I want a schedule. I know it's not today, but I want to work with you and the president on doing free, it's hard to turn down free, by the way, free education on healthcare topics. And so that you're aware, when you do this, and I'm encouraging you to do this, have in your mind what you're going to say. You know, like I don't script things. I'm not talking about scripting, but I knew that I love talking about dementia and educating about dementia. A lot of people worry about dementia care as people get older. Not that you can get it younger and younger, but I could educate on dementia. I could educate on grief. I could educate on caregiving. And she was so welcoming with that. We need this. We need this. And that's how we start to overcome the barrier. We build the relationships along the way. This is a long journey. Kacie, I think, is shared in different venues. And if I say it wrong, Kacie, I'm trying to compliment you and lift you up. But I think she's been doing this at least 3 years, maybe longer. It takes time to build the relationships. You have to invest the effort into the relationships that you're building. You have to build, maintain, and work with. So here's where we're ending. My challenge to you is get out there. Get out there in your community. Join the local Medical Reserve Corps and become a Medical Reserve Corps volunteer. You don't have to be a licensed medical person to join the Medical Reserve Corps. You will go through a background check. They pay for it. Go to different breakfast, usually business breakfast or business lunch. Here, when I was talking about teaching, the executive director was saying, yeah, they have a lot of lunch and learn events. Maybe I could speak at one. So you make these connections and you're out there. And that way, when you get to over here, you know, oh, that's what hospice is for, or, you know, somebody's getting offended. You get to deal with that because you've been building bridges and building relationships along the way. And if you're like me, there are times I put my foot down my throat and out my rear end. It goes horrible. It could be maybe I'm autistic. Maybe I had a panic mode. I got anxious. I said the wrong thing. I was too blunt. You could say, okay, I'm sorry. Let me fix that. Let me work through. Let me show you. Show up consistently. I do thank you for your time. If you have any questions, please comment below. Thank you. God bless.